am a surgical recovery coordinator. I go to the OR when a donor is ready for either withdrawal or to proceed with donation, set up the OR, coordinate with anesthesia, the circulating nurse, and our surgeons, make sure everyone has what they need before we get started, follow the procedure until finish, and then make sure that the organs get out the door in a timely manner to where they're going.
I am a tissue recovery coordinator for LifeShare. My job is basically from the time we get a tissue donor, from arranging the transport and seeing the recovery through from start to finish. So that being from physical assessment through keeping up with the medical charting throughout the recovery, and then sending the patient back to whichever funeral home it's going to after recovery.
I'm an organ recovery coordinator for LifeShare. So what we do is we go in and we manage the patient, the donor, and help to optimize the function of their organs to help maximize the donor's gift for all of the recipients.
I am the community outreach coordinator for LifeShare. So what that means is I get to go into the public and educate people about organ donation, whether that be at schools, civic clubs, through community events like health fairs. I also work with our volunteer program and our tag agency program as well.
I originally was a surgical technologist that worked in orthopedic surgery. LifeShare was an easy transition, just a different side of surgery.
Well, I actually have a degree in animal science because I thought I wanted to be a veterinarian. But then life took me down different paths, and I've always been good at speaking and giving presentations to the public. So that's kind of how I ended up in my role at LifeShare.
I too was also in animal medicine. I thought that I wanted to be a veterinarian, and I actually have a friend that works for LifeShare, and I guess my kind of job is the kind of job, you know it happens, but you don't really think about the people that do it or who does it.
So I'm a registered nurse, and I actually spent 15 years at the bedside, and most of that in the ICU. And then an opening came at LifeShare, and so you're still at the bedside managing a patient, but you actually have a little more autonomy and responsibility.
So we are required to have a certification in surgical technology. Some have associates, some don't simply have the certification. Because of the nature of our position, it's not only maintaining sterile technique in the OR and filling that role, it's also charting and communication and maintaining professional demeanor with the people that you're interacting with. You are the face of LifeShare at the hospital. So I think they look for people that have a professional background as well as a clinical background.
For the tissue recovery position, they prefer you to have 2 years of some kind of associate's degree or 2 years of some kind of medical related job. So working in the animal clinic and some sort of sterile technique was enough to get me in the door.
To be an organ recovery coordinator, they require either a nurse, paramedic, or respiratory therapist. And it can be an RN or LPN. They do prefer for you to have quite a few years of experience.
So for community outreach coordinator, I'm actually in the marketing department, and they would prefer you to have a bachelor's degree in marketing or a related field, or have the adequate experience necessary for your position.
The operating room is organized chaos, especially during donation. So my advice to anyone wanting to fill the role as a surgical recovery coordinator is to get as much experience in a typical OR before you come to donation. A typical OR is usually, except for in emergent situations, is a little bit slower, a little more on pace. And you usually only have 1 or 2 surgeons involved, or 1 or 2 residents with those surgeons. When we have a multi-vis case, we're taking all of the organs. There could be a surgeon, a resident, and a coordinator for each organ involved. We take up to 8 organs. So that's a lot of people in one room. And they're all strangers to each other. They're all from different parts of the country. So managing all of those people in the time frame that we are restricted to make donation possible is is challenging. The two of us are at the helm of that, managing all of those expectations and needs and timeframes. So again, my advice is to get as much experience in surgery in a normal setting before you come to donation.
If you love science, you love anatomy and the body, this would be a good career path for you. I would say if you're very career driven and career oriented, it will be good for you. LifeShare is a place where you can definitely move around and go very far.
To be an organ recovery coordinator, again, you need to be either a nurse, paramedic, or a respiratory therapist. I can only speak for myself, but pay attention in your anatomy and physiology classes. Your pathophys is going to be your ground that you will build upon. Go in the hospital and try to get as much knowledge as possible. You really need the ICU experience, managing those critical trips, and just always find new and interesting ways to keep your field just interesting.
To pursue a career in marketing, learn as much as you can, especially about social media marketing. That's such a huge thing right now. For LifeShare specifically, if that's the avenue that you want to go to, just make yourself knowledgeable about the facts of donation, have a little insight going into that realm.
For tissue, a typical workday for us, we work in 24-hour on-call shifts, and we do not work in the hospital. We have our own private setting that we work in. We could get anywhere from 1 donor to 5 donors. It wouldn't be unusual to work the entire 24-hour shift.
We work 24-hour call schedules as well. Sometimes you work that full 24 hours and sometimes you don't. But a typical case for us is going to the OR when we get notification from our ORCs that we're going to the OR, what organs we're recovering, doing a lot of pre-packing and pre-planning, getting to the OR, doing the procedure, and then maintaining the organs. We put kidneys on pumps before we send them out. So let's make sure that the pumps are calibrated correctly and maintaining the right temperature, and then sending those out. So a typical day is usually spent largely at the hospital.
So as an ORC, we work 12-hour shifts. We go to hospitals. We cover all of the state of Oklahoma, and so we could be going to Tulsa, Durant, next day Oklahoma City. So we go everywhere. We manage the patient, and that's anything from checking their lab work and making changes, changing ventilator settings, titrating critical vasopressor drips in order to see what the baseline function of a heart is. Then we also are the ones who, what we call, run our list in order to find the recipients for each specific organ, and coordinate with all those other transplant centers to find the matches and help set up the OR time for all the different teams to meet at the hospital.
So for me, as the community outreach coordinator, that could involve me going to speak to a school to talk about organ donation, to educate about that, or to like a civic group. It could also look like me going to a community event to educate about LifeShare as well. Also in the department, we are involved with campaigns. You'll see like the OU or OSU football coaches who ask if you have the little red heart. Those are from our marketing department, so we work on things like that as well.
When we have to pass through the ICU to communicate with our organ recovery coordinators who are there caring for the patient, and oftentimes you do pass by the family, and we're wearing our badges and they know who we are. We have family services coordinators that work with those families and make sure that they have everything that they need and understand the process and are happy with the way that it's going. That's probably the hardest part, is seeing the donor family at their one of the most difficult times in their lives.
I'd have to probably second that. It's really hard to kind of go to work and you know you're dealing with death day in and day out, and having to see the families and see their grief, and knowing that they're about to lose one of their loved ones, it can kind of wear heavily on your heart.
For me, the most challenging part, I would say, would be finding my work-life balance, just because the hours at times can be demanding. It is very rewarding, but lots of self-care in my own personal time.
For me, I would say the most challenging aspect would be helping people to understand why organ donation is an issue that they should care about, why it's important for people to sign up as donors. There's currently 107,000 people on the waiting list right now, and that's a large number, but the more people we get who sign up as donors who are able to help upon their death, the better it is for us, and we can get that number down to help save more lives.
When you're in surgery, it's very rare for someone to die during surgery. So the circulators, anesthesiologists, scrub techs that work in the OR very rarely deal with death. So being able to educate where the organs are going and the lives that we are saving and the purpose of why we're there, it's not just death. There is a silver lining to it. I like changing that perspective for the people that aren't necessarily keen to the idea of donation in the beginning.
The most enjoyable part for me would probably be the people that I work with and the family that we've kind of created, because we don't, like I said, we're not in the hospital, and I feel for you guys because we don't see the families, we don't get that aspect of it. So it's really just, we do have cases that are definitely harder than others, so it's just us, and sometimes for long shifts, so we become pretty close-knit family. So I enjoy working with the people that I work with.
I would say the most rewarding part for my job is just knowing that what I'm doing on the front side is going to really impact and help someone else live a longer and healthier life. But also, I've had many families say that this is the only good thing that could come out of losing their loved one. And so it does help heal, I think, sometimes the donor's family as well.
I would say that one of the most enjoyable parts of my job is getting to interact with our volunteers. We have both donor families and recipients. It's really great to see the healing that comes to our donor families from volunteering or from getting to share their loved one's story. Because it is a hard time when they're making that decision and in the hospital, but the healing that comes from them making that gift for their loved one is incredible. It's like something I've never seen before. And our recipients are so grateful. I mean, they've gotten a second chance at life, and they're thankful to all donor families, especially theirs, but I've many a time have seen our recipients thank any donor family member that they can find, and it's really heartwarming to see.
So we have the 8 major organs: kidney, liver, or heart,
Lungs, pancreas, intestine.
But then there's also heart for valves. Even if you don't donate your heart, you can take your heart for valves. We're also taking organs for research. So we don't currently, but we're working on breast tissue and ovaries and prostate for research and potentially, hopefully, for donation one day. We're also taking dorsal root ganglion for research. So those are the primary donations that I organize or help to set up.
Me as well. Yeah.
Typically, you have to be on the list for UNOS. UNOS is the United Network for Organ Sharing, and they have a system where they prioritize the sickest person or the person that's been dialysis the longest is on the top of the list. Also, some people not only need kidney, but they also need a liver. So then that's prioritized differently. So to receive an organ, you need to get on the donors list.
You can also receive a kidney through a living donation. So if there's someone that you know that has the same blood type and also alleles on the kidneys that match yours, or there's like so few mismatches, then you can also have a living donor.
For the kidney and also for the liver. So obviously your kidneys aren't going to regrow, but your liver can. So if everything is just matched up perfectly with your living donor, they can take a portion of, I believe that's the right lobe, and we'll donate that for liver regeneration. Kidneys, when you do a living donation, they usually take the right kidney from the donor. The left kidney has a long vein, so it's easier to transplant. So when someone is receiving a donation or a transplant from the kidneys, usually it's the left kidney that's taken first, and the right kidney, of course, gets transplanted just as often, but the left is usually sought off after more often. But when you're a living donor, they take the right.
I know that organs considered more like life-saving, as tissue is more life-enhancing, and tissue is kind of more like, we have more tissue to go around than there is. Organ is just so much more complex in finding matches, and there's not really a list for tissue. So if you've gone in to get like an implant in your tooth or some kind of bone graft put in your tooth, that's a form of tissue donation that you've received.
We have two routes of death. So there's brain death, and then there's also donation after cardiopulmonary death. So for brain dead donors, we can have babies up to 11 pounds all the way to, I believe it's age 100. I know the donation after cardiopulmonary death, it's also babies 11 pounds and all the way up to, I believe it's age 75. Some cancers may rule out you being able to be a donor. Specifically, probably the most wide known one is breast cancer. And then if you've had certain cancers within the past 5 years, that could also make you ineligible to be a organ donor.
Yeah, so whenever I got into LifeShare, I thought, well, HIV patients can't be donors, or Hep C patients can't be donors, and that's not the case. Active cancer and COVID were the only rule outs for a donation. Someone who is, say, HIV positive, they can either donate to someone who is also HIV positive, or they can donate to someone who is really in desperate need of an organ, and they'll start treating HIV or Hep C at the time of donation. So it's the lesser of two evils to get the organ that and potentially have that infection and fight that infection medically, because then it can still extend your life. Also, if you get an organ that's maybe not the best, someone who's really, really sick will take an organ that's not fantastic, and it will keep them alive for a couple of years until they can get a better organ and have a second transplant. And that can extend their lives even better. So the criteria to be a donor is really quite broad.
The criteria for tissue is not as broad. It's a little more strict just because, as I said earlier, organ donation is more life-saving, where someone will take what they can get to save their lives, versus as tissue you have more options and there's more tissue available to where those kinds of things don't have to be transplanted.
We have 107,000 people on the waiting list waiting for a life-saving transplant. So people should want to care about that. A chance to save other people's lives upon their passing. It's a miraculous gift you can give somebody. I always say it's a miracle because every factor has to just line up so perfectly. And these guys work hard to help that happen. But still, for matches to be made and for this to happen every day, multiple times a day, it's kind of an amazing thing. The last thing is, what is the call to action? So our call to action in this instance would be that we want more people to register to be donors.